Can rotator cuff injuries get better without surgery? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and in regenerative medicine. Common question that patients have is whether a rotator cuff injury or tear can get better without surgery. So what is a rotator cuff? The rotator cuff are a group of muscles and tendons around the shoulder that provide strength and control of the shoulder. There are 4 different muscles. They start at the scapula and they then wrap around the shoulder. The role of the rotator cuff is to provide a full range of motion, power, and stability through that range of motion. This incredible structure allows that full and dynamic range of motion, which also makes it more prone to injuries. So what do you do if you have a rotator cuff injury? There are a number of common misconceptions. Number one is that all rotator cuff injuries are full thickness tears. That's not true at all. In fact, there are different degrees to how we grade how a tendon is injured. Tendinopathy means that the tendon is mildly injured, where there's fraying of the tendon, inflammation of the tendon. Then there's partial thickness tears. That means that the tendon has a small portion of it that's been torn, but that the rest of this tendon is still intact. And then lastly, you have full thickness tears. Within full thickness tears, it means that there is a cut or tear within the whole portion of the tendon. There are non-retracted tears, which means that the 2 edges of the tendon are still closely approximated together. There are then also retracted tears, which means that the 2 ends of the tendon are fully pulled apart, and one side might be next to the bone and the other side is still at the level of the shoulder. So do rotator cuff injuries and tears all need surgery? The answer is no. If you have tendinopathy or just fraying of the tendon, normally just physical therapy or rest is adequate. If that's not sufficient, then considering prolotherapy or PRP treatment makes sense. If you have a partial thickness tear, these also should not require surgery in the vast majority of cases. Studies have shown that 80% of people that have a partial thickness tear of the rotator cuff will be fine with just physical therapy. If that's not adequate, at that point, I would recommend escalating to a regenerative medicine treatment, such as utilizing your own blood platelets, platelet-rich plasma. Now, if you have a full thickness tear, there's some studies that show that physical therapy will help 75% of people avoid surgery and get back to their normal quality of life. If that's not sufficient, if you have a non-retracted tear, where the 2 ends of the tear are still closely approximated together, I would recommend utilizing a treatment where we inject your own bone marrow-derived stem cells mixed with your own adipose or fat cells. That will help to treat this injury and in most cases help you to avoid needing surgery. If you have a fully retracted tear, where the 2 ends of the tendon are now fully pulled apart by more than 2 centimeters, that does require surgery. After a surgical repair of a full thickness rotator cuff tear, does that mean that the tendon is permanently fixed? Well, they've repaired the initial tear, but this is not like changing a tire in your car. The reality is that the tendon is still weakened, which means that there is still a very high chance of having another tear occur to that tendon. Depending on the degree of the tear, that chance of a repeat tear after rotator cuff surgery can be anywhere from 25 to 75%. What is recommended is after a rotator cuff repair surgery, because of that high rate of recurrence of tears, you should consider augmenting that with your own bone marrow-derived stem cells. That will help to strengthen the tendon and help to prevent a repeat tear. So to sum up, rotator cuff injuries are definitely very painful. Understand that there are certainly conservative treatments that can be considered and frequently will work before surgery as well. If you found this to be helpful, please give us a like and subscribe to the channel. Until we connect again, have a good day and live well. Bye-bye.